is such a case where all of us realize that the future is very unpredictable. Bill Gates about 2 years said that 640K computer is enough for an individual. But it's proved very wrong in many years. AI, that is artificial intelligence, which is the new tool in the world, which has really changed our lives, has already entered our life over last, say, many years. And what has happened? Whether it's a Google map or whether it is when you are really traveling, DG Yatra, everywhere AI has really come. So when we talk about AI, normally there are two types of AI. One is what is called as a discriminative type of AI. So it discriminates one thing from another thing, whether your face versus somebody else's face. When there is a recognition by digitally, it is a discriminative type of AI. That's the one which discriminates the chest X-ray of a pneumonia versus a normal person. On the other hand, last 3 years we have seen the generative AI. What is generative AI? Generative AI means it's a content generation. We have seen now people creating PowerPoints, articles through ChatGPT, academic chatbots. Now, what has happened? The things have gone further into this. Now, many times you find that the patients, now all the summaries are put into and we get what is the right treatment for the patient. Today I have seen many students, when they are taking a round and they find a difficult patient, they will first put into ChatGPT and find out what is to be done. People are, recently there was a survey in the British system and they found 83% of students are using AI for their teaching. So we cannot stop people using AI. And that's the reason why many times the surgeries are done. You are doing a 3D kind of a printing, you are doing 3D visualizations. You are putting videos and then the robot tells you how to really operate. So things have gone much ahead than what we all thought. Now the main question really comes to us is that, is this going to replace a doctor? And this is where everybody really, there are so many news which come. The first news came from China that they have opened an hospital which is an AI-based hospital. Previously, I remember about 2010, I had heard a talk where there were all nursing assistants were replaced by AI. In Operation Theatre, there is no nursing or OT assistant, but there is an AI who is giving you. People are giving robots to give sushis, everything they are really giving. But now when it says, is it going to replace doctor, everybody has to really think. Now how do they look at this whole problem? Clinical patient is a very complex problem. The doctor treating a patient is a very complex problem. So when you start looking at these problems, you look at two major parameters. One is how much of the work of a doctor is repetitive and how much of the work is creative. Now this is the most important aspect which we should really understand. Now for example, if you are doing every day, you are seeing some patients and you are having a protocol, many times, the radiologist goes on seeing same lesion, same treatment. When you are seeing in an OPD, there are about 200 patients, but out of which many patients who have the same formula which is given. On the other hand, there is a lot of creative work. So that creative work which requires a lot of thinking. You require a lot of sitting together, when you say a tumor board, many doctors sit together, they think about it, and then they take a decision. So there are two, this is one parameter, there on one side there is a repetitive work, and other side there is typically you find a creative work. Now the other side, what you should really also see is that we as a healthcare people are studied with the data. The data begins as soon as we start preparing the registration number. Then we start writing histories. Then there's an images, X-rays, CT scans, lab reports, and you find files go on increasing if the patient is there. Now that data-based decisions are very important. Now today, previously we had to go through all this. Today, you will find, you put all these papers to AI and it will give you summary and it will give you also diagnosis. On the other hand, you will find some areas we find an interaction which is absolutely necessary with the patient. You need to talk to patients. So imagine there is a framework where on one side there is a creative work, other side is a repetitive work, and crossing to it is a data-based decision making and interaction-based specialties. Now, if you really go through details and find out, there are 4 types of specialties you are going to see. Now, first specialty is like data-based and repetitive work. Now, this specialty you will find that the AI will definitely replace many things in this particular group. Radiology, dermatology, these are the branches where you see complete change coming up. So the radiologists will now have to concentrate on the complex tasks. So where there is the data and there is a repetitive work, the computers will get themselves trained. Now if there is a routine X-ray, if you say imagine you have a computer who is trained with 1 million X-rays, he will be able to definitely give you an idea whether this is pneumonia or not pneumonia. He will definitely give you whether this is cancer or not cancer. At least he will suggest. So the doctor's role becomes lesser and lesser. Of course, there are some cases where the doctor will have to really make a choice. On the other hand, there are interaction-based with a creative kind of specialties. Something like mental health, psychiatric problems, patients who have a lot of, these kind of problems, neurology, these ones, they will not be affected by the AI because these are creative problems in time and there are a lot of interaction with the patient is required. AI is still not ready to do this. So if you look at the 2 corners where there is a repetitive and database like radiology and dermatology, AI will definitely replace some of them. But if there is an interaction based and there is a creative work, you will find the AI does not have any impact. What about other specialties? Let's look at other specialties. Look at specialties like surgery. Now, surgery is technology based. Technology is coming in a big way. Now, here we have to really understand that there is a surgery, cardiology, gynecology, these specialties have lot of data, lot of creativity. Like a surgeon when he is operating, he is continuously doing this work all the time. Now these specialties will have a partial impact because of the AI. But today if you really see, AI has really changed the way surgery is being done. Look at MHPE surgery, look at liver surgery, transplants, look at neurosurgery. Even a hospital like, public hospital like ours, where we now do 3D printing, we do HoloLens, and we now try to get a much better kind of an image. And that is where I find the lot of AI will help you. So one will replace partly, one there will be no effect, but these kind of specialties like surgery, gynecology, cardiology, there will be a partial impact where people will have to really use AI effectively to understand this. And why this is important for you? Because you are very young. Today, after 10 years, the whole world is going to change. And you have to prepare yourself for this. If you don't prepare today, you will be thrown out of it. Human overlook on every clinical decision is going to be extremely important for you. So if you really feel what we should really do, I think we all should be AI literate. We should all become AI literate. But actually, what does AI do? We all have data, which is we create so much of data. Now, data, when it is organized well, it becomes information. Now, when you bring a meaning out of it, it becomes really the knowledge. And when you try to bring solutions and wisdom into this, That's where the AI will really, what does it really mean? You're trying to bring some knowledge, but what does it really mean? Now that becomes wisdom. Elderly people then used to really see, they bring wisdom. So AI sometimes brings you wisdom. But what is important for us? We have to learn AI. We have to become literate of AI. We should know what are the advantages of AI. At the same time, we should know what are the disadvantages and limitations of AI. AI is good, it is accurate sometimes, it really gives you a lot of content, it helps you doing so many tasks. But imagine, you are just putting something in AI and you are using a free version, it will give you so many wrong things. Your references will be wrong. So you will have a wrong kind of a choices. There are so many biases. The AI they will always give you, because they have global norm bias, they will always give you something for a white skin rather than a black skin. When you talk about that matter also. They'll always talk about, will they have a data of rural India which they compare? They'll always have published papers of the Western world. So if they have a solution which is based on the Western world, will it be applicable to my own people? Will it be applicable to me? And is that available to me? They may give me the best possible, but I will have to really see whether it works for my patient. Now this contextualization has to be done by a physician overload. And this is where the value of a physician is important. And this is where I feel all of us should become AI literate. Now over years, do we take consent of a patient when we are using AI for his decision? Now that becomes very important. Will patients agree that you have been operated by AI? And will patients agree? I'm sure. And there was almost everybody says, I don't want AI to take decisions for me. I want the clinician to take decisions for me. And this is a published paper. So if you really see, today people still don't trust AI. Maybe they are trusting it for routine things like collecting report, organizing reports and everything. But when it comes to clinical decision making, that is the time people don't have trust. And therefore, I feel ethically, we should be very careful that by using these decisions with so much of bias, hallucination, errors, should we really put the patient's life at a risk? So if you don't want to do it, then what is the best way out? Best way out is to learn AI, augment and support our decision making with AI, but don't totally believe. You have an overlook over it. Bring the context into this. See whether it is validated in my own patients, type of group of patients. Is it going to be looking well for my patients? Is it going to do good for my patients? And if it is so, then only it will do. And because of these facts, we are far from AI replacing the physicians. So I feel what AI will do, AI will definitely improve the clinical service by doing a lot of decision making for a service. It will help people, like for example, it will how it will really help. It will definitely help you when you put symptoms, and it will tell you which doctor to go. What I will do, many times Google misleads you, but now better health chatbots will probably give you, at least tell you go there, so you go to a human, it will direct you. Once you come back, it will help you to really do good queue management. Clinical softwares, clinical flow software it is called. Something like KEM has 800 patients. And you will find that out of that 800 patients, 150 require ICU and 50 require ventilator every day. How do we get rid of this? So then we have to really see that how we prioritize and put everyone so that all services are utilized well. Now this can be done with AI. Something like radiology, pathology, we can get, and today also many times when you are getting the laboratory reports, you will get an AI analysis of those reports. You know the trends. They will give you suggestions. Then when you are taking patient decision making, they will give you a lot of suggestions. They may think about something which may not have thought about a real diagnosis. They give you an idea. They will help you in operating. They will give you post-operative outcomes. They will detect patients of saving lives in ICU. And post-operatively, once you go home and you write the proper discharge, they will help you about the drug errors which we do. And also, when you go back, they will help you in following these patients. So they make your job simpler, but all of these will require your own supervision. So what I would like to really conclude and what I like to say, that AI has come, all of us should accept AI. Maybe I am the eldest person in this crowd, talking to the youngest people here. But AI is something we should do it, we should learn, be literate about it, understand where it is useful, also understand what are its limitations, use it ethically with academic integrity. And I'm sure we should try to have a collaborative relationship with AI. And we should take forward this collaborative relationship rather than allowing them to replace us. So yeah, hospitals are there are no doctors, but I don't think what is the future. Nowhere in the world it has been replicated. I feel the AI will not replace doctors, but it will definitely replace doctors who don't understand AI. With that, I would like to thank you so much.